Hello everyone, my name is Dr. Ann Auburn and I'm the founder of the Natural Health Improvement Center in Grandville, Michigan. I'm a family practitioner, but I also have training in osteopathic manipulative medicine. That's the kind of adjustments that osteopaths do, similar to chiropractic. But also I'm board certified in integrative medicine, so I'm always coming up with interesting topics that people ask me about at the clinic. Now this is a popular one, detoxification. So we're going to talk about not only the importance of detox, but how we do it to maintain optimal health and why you might be someone who wants to do it. So let's get started. So our objectives are review the common toxins and how they affect the body, review the body's mechanisms for detox, review the benefits of detoxification, whole body simple detox anyone can do, daily dietary measures to enhance detox, and what supplements might you need for detox, some that you can just take on a daily basis, and what is chelation therapy. We're going to talk about that in detail, and how does it work and why should you consider doing it. So let's look over this little mini questionnaire for detoxification. Do you often feel tired or have lack of energy? Do you have sore muscles for no apparent reason? Do you have difficulty concentrating? Are you easily irritated or feel moody? Do you have trouble sleeping? Do you feel bloated or gain weight easily? And let's see, what else do we have here? Do you feel like you're not as healthy as other people your age? If you answered yes to any of those questions, then ask your health provider about the potential benefits of detoxification, and if they have one for you. If not, we can help you out at the Natural Health Improvement Center. All right, let's get to the next slide. There we go. Okay, so chronic disease. According to the Journal of the American Medical Association, JAMA, a very popular and well-known medical journal, chronic disease is now the principal cause for patients to come to the doctor. This JAMA article that I'm mentioning concludes that today's physician really is not fully trained to handle the rise in chronic disease. So we need to change. We need to get a new paradigm, a new approach to the rising incidence of chronic disease. Detoxification is a major key to the reduction and prevention of chronic disease. So overview of detoxification. Exposure through air, food, water, even stress can add up to over 14 pounds of pesticides, herbicides, food additives, and preservatives, plus all the inflammation that comes with those per year for an average American. The liver, together with the gastrointestinal tract, are the organs that are responsible for removing these toxins through the process of what we call biotransformation. If the liver isn't working well, every other system in the body is at risk due to fat-soluble toxins, which are poorly excreted and become stored in the body. The process of biotransformation is performed through a two-step enzymatic process known as Phase 1 and Phase 2 detoxification. Phase 1 is composed of a series of 50 to 100 enzymes called the cytochrome P450 system. You may have heard of that because some medications are processed through that too, and we have to be careful combining those with other medications or even supplements and herbs that go through that same system. So this takes the chemically harmful fat-soluble toxins and changes them into intermediate metabolites. Enzymes help the processes of oxidation, reduction, hydrolysis, hydration, and dehalogenation. So those are a lot of big words, but the bottom line is there's a process to get rid of this stuff. And we don't want to overload our livers, so we want to constantly be helping it to detoxify. So nutrients that you need for this are a lot of your B vitamins, glutathione, and flavonoids. So you're going to get a lot of those flavonoids from citrus type foods and also in a lot of different fruits and vegetables. So these intermediate metabolites from Phase 1, they're often more toxic than the original fat-soluble toxins and must go through Phase 2 conjugation. Conjugation means to bind the toxin, and that conjugation makes it into a safe inert, so not harmful water-soluble compound, which is then excreted from the body by urine, bile, and stool. So we need our kidneys too, they're very important. Conjugation pathways, you may have heard of some of these before: sulfation, glucuronidation, glutathione conjugation, acetylation, amino acid conjugation, and methylation. Methylation's a big one. A lot of people have heard of that because they may have the dreaded MTHFR gene mutation, which isn't really so horrible. We can actually handle that, and we test for that all the time. And there's many workarounds for your body with that as well. But these enzyme pathways remove toxins and scavenge free radicals. And again, you need some B vitamins like B5, B12, folic acid, methionine, cysteine, glutathione, glutamine, glycine, choline, taurine, and zinc, and then of course our good old buddy vitamin C. So you can see why it's important to take a multivitamin. I mention these, necessary nutrients all the time because I think everybody should take a multivitamin. I think it's very necessary. I don't think we're getting enough of it in the food that we're eating today. And we're always stressed with these chemical toxins, as you'll see here. Biochemical stressors lead to toxic exposure and disease, and these would be things like smoking, tobacco, or just being around somebody who's smoking or using tobacco. Secondhand smoke can sometimes be worse in some ways. Industrial waste, work exposures, plastics, lack of purified water, environmental toxic chemicals including drugs, heavy metals, pesticides, herbicides, toxic foods that maybe have unusual chemical hormones in them, other chemicals, colorings, flavorings, hydrogenated oils, and more. And the labels, can be difficult to read because sometimes you think, something says that it's natural, and then you look on the label and it's got hydrogenated oils in it. So it's, it's difficult to eat well. So I always tell people, eat real food, work around the outside of the store. That's where all the real stuff is going to be. And yes, we all buy some boxed food and frozen food and things like that, but get the things that are the cleanest you can possibly get. Predisposing factors and exposures make patients vulnerable to disease, and each patient will respond differently. Stress, negative emotions even, toxic relationships, those are toxins as well, and I try to encourage people to, handle those and make them better, or, make sure they're surrounding themselves with good people and good situations. Watching violent TV, playing violent video games, these two have been shown to make your immune system not work as well and put those toxic inflammatory mediators in your system. Toxins will cause or worsen, if you already have some of these things: fatigue, pain, weakness, body aches, headaches, heartburn, gas and bloating. Any gastrointestinal problem can be made worse by toxins or stress. Memory problems. We all the time we're working with people that think they have memory issues, or they have been diagnosed with memory issues, and we're trying to help them clean up their body and their brain and their gut so that all of their functional parts of their nervous system work optimally. Also, blocked arteries. If you already have heart disease or vascular disease, it's even more important to detoxify. High blood pressure, immune function, or I should say immune function is worsened, but also if you have immune dysfunction, it's going to be worse. Cancer, chronic medical conditions, much, much more. That just gives you a spattering of what we're talking about here, things that can get worse. So if you already have some of these things, you definitely want to detox, but we should all be detoxing. I do it on a regular basis. So the air we breathe, it's polluted with toxins. There's just no way to get away from it. It's an industrialized world, and that's what we're dealing with. So we have to face the music and take responsibility for our bodies in that situation. Air pollutants can be anything from plastics and phthalates, which can come from furnishings, carpet, auto parts, auto dashboards, computer housings, kitchen appliances, teething toys for babies even, plastic water bottles, fumes from all of the above, construction materials. Other airborne chemicals: auto exhaust, industrial incinerators exhaust, airplane exhaust, industrial waste. Other airborne chemicals can contain organic hydrocarbons, including formaldehyde, toluene, benzene, heavy metals, pesticides, and I can't read that last one, but I think it's zoluene, something like that. So, again, another terrible toxin, and I hope if any of you are out there that are smoking, you really just keep working at quitting, and eventually you will. I've seen so many people struggle with this over the years, but they can do it, and they eventually do if they don't stop trying. Dr. Flynn has some great acupuncture methods to help reduce the cravings that have worked for a lot of our patients. But it is the single most preventable cause of death in this country. It causes free radicals. We're going to talk about what those are later. It causes damage to tissues. Of course, it's the most significant cause of lung cancer and the leading cause of lung cancer death in both men and women. And cancer in our fur babies. Cats and dogs that are around that all the time definitely get exposed. Responsible for most cancers of the larynx, that's your throat area, oral cavity, and esophagus. Highly associated with the development of and deaths from bladder, kidney, pancreatic, and cervical cancers. Environmental tobacco smoke is responsible for lung cancers in thousands of non-smokers every year, and that's from the U.S. EPA. It contributes also to allergies, asthma, respiratory conditions, respiratory infections, and it contributes to coronary artery disease, according to the EPA again. Water contains impurities as well, so think about the water that you're drinking. In my household, we do reverse osmosis. I know that takes out the minerals, but we put mineral drops back into it. At my office, we have a ionizer, and in addition, there's a couple of carbon filters that I offer to all my staff, and we drink at the office. And we also have water dispensers at the office for our patients. Just make sure your water's purified. Water can be so toxic, even if it's well water, even if it tastes great. It's amazing how much water can have in it from the toxins in our world. They say that most of the streams and lakes are polluted now with the residues from drugs that people use all around the world, all around the country. And the food we eat, of course, it's nutrient depleted and chemicalized. So we again try to find the best we can. Grass-fed beef, Amish chickens, free-range chickens, things like that. And we should know our suppliers. And yes, we're all going to eat out sometimes and not get the best food, but you try to get the cleanest you can. I always refer people back to the lists of the dirty dozen. The dirty dozen are the ones that you should definitely always get organic. The clean 15 are the ones that you can, eat non-organic and be pretty safe. So, but a lot of these foods that we eat, they're definitely, littered with pesticides and herbicides and chemical fertilizers and made from genetically modified seeds. So, that is passed on to us. Aspartame and artificial sweeteners. As of 1995, over 75% of all adverse reactions. That's a bad side effect from the drug or the item. Reported to the FDA were due to aspartame. Aspartame is NutraSweet. It's the technical name for, I already said NutraSweet, but equal spoonful and equal measure. A study published in March 1986 in the issue of Preventive Medicine examined the use of artificial sweeteners by about just under 79,000 women ages 50 to 69. It found that the users were significantly more likely than non-users to gain weight. So artificial sweeteners aren't helping with weight loss that much. If you really want to use something that's clean, I recommend stevia or monk fruit. Yes, we can do a little bit of honey or maple syrup, but if you overdo those, you're still getting a lot of sugar. So please don't use aspartame. It's definitely related to bladder cancer. It's definitely a carcinogen. I can't believe they can still sell the stuff. Okay, and industrial chemicals, we mentioned some of these already, but often in the workplace or even in our neighborhood, I've reviewed studies before of children in China that live next to coal burning factories or even in the States, living next to a coal burning factory, they definitely have more heavy metals and other toxins in their bodies. Newborns. There are toxins in newborns already, so if you're getting ready to have a baby, you try to eat as clean as you can as long as you can before you get pregnant. Take vitamins, detox on a regular basis. In the cord blood of newborns, there's over 250 chemicals that are foreign to the human body, and 26% of those babies will already have mercury at birth. It does cross across the placenta from the mother to the baby, so moms, do the best you can to clean up that stuff and prepare for your pregnancies. Last point on that is also it's found in breast milk too. Now, heavy metal toxins, here's just a brief list. They're almost everywhere. They cause inflammation. They cause immune system dysfunction. They are all neurotoxic. That means nervous system tissue damage. And they contribute to arterial blockage and organ dysfunction, and I'll explain that later when I get into lead a little bit more. But these can be found in various places that you might not think they are. Everybody knows about leaded paint, and that being in houses that we might buy that are old that we repaint or clean up somehow, but also gasoline, batteries, cosmetics, jewelry, and wine. I know some of you are going to hate to hear that, but definitely wine has both arsenic and lead in it. In most domestic wines, I learned more about this a few years ago when I redid my heavy metal toxicity and chelation training, and it's just, I really don't even drink a glass of wine. I'm not a big drinker anyway, but when I do, I always get the foreign wines. I get the wines from New Zealand or Australia or Brazil, or I don't usually drink any wines from California. I mean, I guess if it happens occasionally, it's probably not that big of a deal. But if you're a wine drinker and you drink it regularly, and please don't drink too much. It's not good for you either, but it's going to be in there. And mercury, I found out recently, not only can it be in some fish and your silver amalgam fillings, paint, vaccines we all knew about, but high fructose corn syrup, the way they make it, it's definitely processed and has some in there. Arsenic is also used in chicken feed. It's used in crop sprays. It's found in groundwater naturally, and as I said earlier, wine. Cadmium is a lot of it's tobacco, plating on metals, nickel cadmium batteries if you work in a factory putting those together, or if you're around them a lot for some reason in your work. Tires, and a lot of different rubber products have cadmium in them. And then aluminum would mostly come from antiperspirants, antacids. A lot of people self-medicate with over-the-counter antacids. Aluminum foil, cookware. And then nickel is in cigarettes, also some plating on different metals, also in some soy and cocoa products. So that's just a brief rundown. That's not the, ultimate information on where all those come from, but that's a few common sources. So what do toxic heavy metals do? They're neurotoxic, as I said earlier. This damages the nervous system. Many studies done on young children that are exposed to it. We all learned a lot about that when Flint had their water crisis and there was lead in the water. At very small levels, it can cause damage and make it difficult for children to learn and grow. Nephrotoxic, that means it damages the kidneys. These would include lead, cadmium, and mercury. For the neurotoxic, lead, mercury, and arsenic. Cardiovascular disease, decreased circulation. They cause dysregulation of the immune system, compromise the gastrointestinal integrity, compromise your nutritional status, and they're carcinogenic, especially lead, cadmium, and arsenic. So more detail later, but that's a brief overview there for you. Heavy metal toxins are often found in over-the-counter herbs, especially Ayurvedic herbs. There was some particular problem with this in Ayurvedic herbs that were sold over the internet, and they contained lead and mercury, and it's known that 20% of them will contain these heavy metals. The ones that they found in a particular study that I'll show you in just a second, were far in excess of what is acceptable by the safe standards set by all states, but also the state of California. 750,000 Americans have used Ayurvedic herbs, and according to Doctor's Data expert David Quigg, it's amazing how many of these herbs have heavy metals in them and how high the levels are. So in an analysis of one over-the-counter Ayurvedic herbal preparation, and this is not that they're all bad. I think Ayurvedic herbs are great. We carry some organic ones at our office. But in this particular one, there was 50 milligrams of lead per gram of the herb. That is ridiculously high. The patient that was taking the herb had a level of 9,800 micrograms per gram creatinine. That's how we measure it when we do a urine toxic metals test. Normal is less than 5. So this person was incredibly toxic and having symptoms, unable to think clearly, function well, very tired, having pains, etc. And when they were detoxed, they came back to normal. So arsenic, let's talk a little bit more about that. Arsenic's the #1 heavy metal toxin, and its overuse is one of the greatest travesties of mankind, according to David Quigg, Doctor's Data Lab. Arsenic is 20 to 30 times higher in urban than remote areas. Arsenic is found in meat, fish, poultry, herbicides, insecticides, fungicides, mushrooms, tobacco, herbs, teas, wine, vineyards, orchards, cotton manufacturing, fossil fuels, particularly coal-fired plants, mining of copper and metal alloys, zinc liquid fertilizers, and wood preservatives. Now, they've taken most of this out of the wood. This used to be in the wood that they use for decks and for children's, jungle gyms and things like that, but they have taken that out. But if it's an old one, it might still be there. Heavy metals and circulation. Heavy metals cause inflammation and excessive free radicals. I'll talk to you a little bit more about that in a second, what those are. This can lead to tissue damage and or plaque buildup in the vessels, blockage in the blood vessels, which can lead to circulation problems. This can result in angina. This is decreased circulation to the heart, causing chest pains. Also stroke, foot infections, especially in diabetics, brain fogginess, and increased fatigue. So the free radical theory of aging, let me just go over that with you real quickly. The free radical theory of aging states that organisms age because cells accumulate free radical damage over time, which is true. There's a few other mechanisms for aging, like mitochondrial dysfunction, toxins, overwhelmed organs, things like that. But free radicals, let's explain those real quick. A free radical is any atom or molecule that has a single unpaired electron in its outer shell. I don't know if you remember this from your science classes, from chemistry in high school or anything, but basically a free radical is a atom or a molecule that has this unpaired electron on the outside kind of spinning around it, and it makes them very highly reactive. They're searching for another another particle to pair with it so that it's not so reactive anymore. So for most biological structures, free radical damage is closely associated with oxidative damage. You may have heard of that. It's kind of like an apple that sits around and gets brown, or your car maybe, or a piece of metal that rusts. Similar concept, a little bit different. Some oxidation's good, some is bad. There's always going to be some, but we want antioxidants in our food and in our supplements to limit oxidative damage to biological structures by getting rid of those free radicals. So I had to throw in a little bit of humor here because we're talking about such serious things, such scientific things. Antioxidant meets free radical at the bar. So those aren't exactly what antioxidants and free radicals are, but hopefully now you'll remember it a little bit more. Free radicals are kind of bad, and antioxidants are good, and they balance each other out. Lipid peroxidation. So free radicals are very chemically reactive, as I said earlier, because of that unpaired electron floating around on the outside of it. And if not controlled, they will cause damage to cell membranes by lipid peroxidation. Cell membranes are made up of lipid layers, phospholipids we call them, And they're a protective barrier to keep the inside contents of the cell from mixing too much with the particles from the environment outside the cell. And of course, there's little passageways for, things to get in the cell and out of the cell. But just like your skin, this lipid layer protects your internal organs. The lipid layer protects the inside of the cell. So damage to the cell membrane occurs with lipid peroxidation from free radical damage. It's like an open wound in the skin, which is now leaving your internal organs unprotected from damage. So let's see what they look like. Over on the left, as you're looking at the screen, that is a normal cell. You can see the lipid bilayer is all nice and neat and put together, and then you've got your little protein channels and protein molecules and carbohydrate chains and various things that are trying to go inside the cell. And then on the right, this is another depiction of it, but you can see that there's a lot of stray pieces just sort of floating around. There's a little bit, damage there, and that would be a schematic depiction of the outside of a cell membrane being damaged by free radicals. So toxins cause or worsen free radical production. Like I mentioned earlier, smoking is terrible. It's a definite cause of free radicals. Heavy metal toxins, chemical toxins, excessive alcohol, stress, medications, sleep deprivation, inflammation from injury, disease, hormonal imbalance, obesity, or toxins. It sounds like I'm talking about all the things that we take care of at our clinic, but we do. We help people stay younger longer by keeping these systems working and keeping the damage controlled. So free radical production is normal. It happens all the time in our bodies. We have to have it. It's a part of body chemistry, but excess production, that is the problem. If your free radical production is much greater than your antioxidants and your organs can, make up for, then you're in trouble and you're going to be aging faster. Now this slide is just to show you some relationships between an actual dysfunction, an actual disorder, and lead, a heavy metal toxin, which is one of those things that's going to cause free radical damage. Lead and attention deficit disorder, you can see basically the graph is showing a bar graph of different levels of lead found in a hair sample. The higher the lead that was found, the higher the percentage with a higher deficit rating. So in other words, the more lead they had in their hair, the more attention deficit disorder they had. There's a direct relationship. There's many things that go into attention deficit disorder, but this could be one of the things, and one of the things I would try to clean up at my office. Now I'm going to run through the next series of about 10 slides. I don't want to spend a lot of time on them, but these are samples of actual studies that were done throughout the 80s to 2000s, and basically it showed how lead, it's just one of the worst heavy metals. Lead, mercury, and arsenic are probably the worst. Cadmium's right up there, but lead is so common, and it's associated with heart attack and stroke. In random blood samples greater than just 2 micrograms per dl, that's deciliter, so that's when they draw your blood. Now, normally they say it's safe. I can't remember the exact number right now, but I think it's up to a level of 3 or 5 or something like that. And we're not talking micrograms per deciliter. We're talking larger numbers, but at just a tiny amount of greater than or equal to 2 micrograms per deciliter, it was significant as far as its relationship to heart attack and stroke. So again, lead toxicity in primary care, despite a 75% or greater than 75% reduction in blood lead levels since the 70s, 38% of U.S. adults have levels 2 micrograms per DL or greater. It's very common. 151 to 248% increase in death from cardiovascular events. And 88 to 189% increase in death from a heart attack, myocardial infarction. So lead definitely is related to cardiovascular, neurological, renal, meaning kidneys, degenerative, like autoimmune, osteoporosis, and cataracts. And that was written up in the journal Circulation, a very highly respected, peer-reviewed journal in 2006. Some more articles here for you. Lead associated with hypertension in women. Another article here for you from 1996, and this is JAMA, the article I mentioned, or the journal I mentioned before. Lead associated with hypertension in men. They were looking at the relationship of bone and blood lead levels and what diseases it was related to, and they definitely said it's related to hypertension. I mean, how many people are walking around with what we call idiopathic hypertension, like can't explain it, don't know why, but in traditional medicine they really don't look at this. They don't really consider it to be a problem. It's not within the paradigm of traditional medicine, but luckily us in integrative medicine are looking at this problem. Lead bone stores associated with future ischemic heart disease. Okay, another bad thing that you could die from. Lead, cardiovascular mortality when found in bone, even if low in blood, there is an increase in all-cause and cardiovascular mortality. Why is this significant? Because when we do a urine toxic metals test, we are not just looking at the level of blood lead. That is somewhat of a useless measure. It does tell us if you've been exposed in the last couple of weeks, because lead in blood only stays there for a couple of weeks after you've been exposed. So if you have it high in your blood, you are currently being exposed. But what if you're not currently being exposed? These heavy metals can stay in your body for up to 90 years. You have mechanisms to get them out, but it never all comes out on its own. So if it's not in your blood and you think, oh, I got a blood test and I'm good, that's not true. If it's in your bone, it's still going to put you at risk for cardiovascular disease. And when we do a urine toxic metals test, that's what we're looking for. We're looking at what is retained in the body. We'll talk about that a little bit more later. Lead is associated with intimal hyperplasia. Now, intimal hyperplasia, what is that? That is hyperplasia or thickening of the inside of your blood vessel. And this is a major cause of cardiovascular disease. Lead causes chronic kidney disease, even at low-level exposure. There was several studies on this, and it's definitely related. So if you've ever been told you have chronic kidney disease, stage 2 or stage 3 or stage 4 or whatever, if you have a GFR of less than 60, it could be from lead. You should really get your urine toxic metals test done at our office. Lead accelerates kidney disease and hypertension. 2007 study shows vascular, inflammatory, and kidney trouble. Kidney tubule injury worsens renal disease. Kidney tubules are part of the kidneys that are very important for filtration of toxins to get those out of your body. And kidney tubule injury worsens renal disease, and it is related to hypertension. So this study went over that, and this study was from 2007, so not that long ago. Lead, why and how does it cause cardiovascular disease? Well, there's clinical evidence for lead-induced inhibition of nitric oxide formation. Well, you're probably sitting there saying, okay, big deal, what's nitric oxide? A lot of people know about nitric oxide because it's good for people who have hypertension. It dilates blood vessels, and also it's in a lot of products that are for erectile dysfunction, because that is based on circulation and dilation of blood vessels as well. But look at all the functions of nitric oxide. It's also known as endothelial-derived relaxation factor. It dilates blood vessels. It reduces platelet stickiness. Well, that would be good to not have clots. It reduces monocyte stickiness, preventing formation of plaque. It reduces multiplication of smooth muscle cells of the artery wall. Yeah, we don't want those artery walls thick, because then they're not going to, be as flexible and dilate as well. It reduces release of superoxide radicals. It reduces oxidation of LDL cholesterol, a major component of plaque. So you can see how all of this would help you not have cardiovascular disease. So the functions of nitric oxide regarding dilation of those blood vessels: it's a signaling molecule, it's a powerful vasodilator, vascular endothelium is involved in the release of nitric oxide. also known as endothelium-derived relaxing factor, EDRF. Drugs that enhance nitric oxide production are like nitroglycerin. You've probably heard of people that have angina using that, or Viagra for erectile dysfunction. Endothelial dysfunction is the initial step in the pathogenesis of atherosclerosis, and here's the paper that goes over this. This is from Circulation, Journal of Circulation, 2009, Endothelial Function and Oxidative Stress and Cardiovascular Disease. Basically, they're saying when those blood vessel walls get damaged, that's endothelial dysfunction. This is the initial step in the pathogenesis of atherosclerosis, which is the plaque that gets in the middle layer of your blood vessel wall. And then later on, it can break through and cause a blood clot, causing heart attack, stroke, or other problems. So common sources of exposures to heavy metals, again, just as a review: power plants, automobiles, diesel fuel, metal foundries, paint, insecticides, herbicides, wood preservatives, amalgam fillings, disinfectants, plastics, vaccines, drinking water, food, fish, and fertilizer. And I can say that I've seen pretty much all of these in patients that I've had over the last 25 years doing heavy metal detoxification. Metal exposure from agricultural products. I just want to mention this because crops and pastures are legally contaminated with toxic metals from zinc, micronutrient fertilizers known as biosolids, in other words, sewage sludge. Industrial toxic wastes in inorganic fertilizers also. Manufacturers buy industrial toxic waste as a cheap source of growth-enhancing zinc and iron. The wastes frequently contain arsenic, lead, mercury, cadmium, chromium, not the great kind of chromium, and dioxins. So these are all bad things for us, as we've been saying. About half of the U.S. zinc fertilizer is made with about 46,000 tons of hazardous waste. Yuck. So biosolids as fertilizer. It's dried sewage sludge. It's another form of fertilizer. It contains human biliary excrement and contents of wastewater, which is a huge source of these heavy metals because a lot of people have them and don't even know it. And it's contaminated with mercury, lead, antimony, cadmium, thallium, copper, etc. Toxic metals in fertilizers. 20 out of 29 fertilizers purchased in 12 states contained levels of toxic metals that exceeded the EPA limits set for wastes destined to public landfills. So, the California Department of Food and Agriculture predicts that food grown with contaminated fertilizers will be the greatest single source of exposure among Americans. EPA cites mercury as air pollutant of greatest concern. Greater than 50 tons per year of mercury from combustion in the U.S., coal-fired power plants, municipal hospital waste, and the top 10 emitters include Michigan, but also Ohio, Texas, Pennsylvania, Indiana, Illinois, West Virginia, Kentucky, Alabama, Georgia, and North Carolina. So let's again look at some of the effects of heavy metals in circulation. Amalgams are the silver fillings used by dentists, and they are 50 to 70% mercury. They should be banned, but they're not. 3.4 tons of mercury per year goes into sewers and septic systems, mostly from, or I should say much, not mostly, but much of it is from dental fillings. Fecal mercury presents a huge source of environmental mercury. Dental amalgams are the primary source of mercury in feces. So elimination of the use of mercury in dentistry is required to decrease environmental pollution of this toxic metal. You can see on this chart here that the more amalgams you have going to the right on the chart, you see the bar graph go up. The more amalgams you have, up to, I think they have 14 on this chart, 14 silver fillings, the higher your mercury is going to be in your stool, fecal mercury. So it does come out. It's not stable. It doesn't just stay there. Every time you drink something hot or cold and your teeth expand or contract, every time you chew, you are releasing mercury. I've seen this demonstrated at a couple of seminars that they can measure the mercury after you chew gum for a few minutes. So it's there. If you have silver fillings, get our dentist list and go to a dentist who knows how to take those silver fillings out correctly, and you will be better for it for your long-term health. So methyl mercury in fish. The FDA threshold limit for commercial fish mercury is 1 part per million. Fish consumption advisories are in 43 states. Women and young children should not eat any shark, swordfish, tilefish, or king mackerel, according to the FDA. And 10% of all U.S. women have blood mercury levels greater than that needed to create fetal risk for neurologic effects. So again, if you are a young woman thinking of getting pregnant and you have silver fillings, get them out and get that taken out correctly. There's a specific method to do this. Don't just go to any dentist to have this done. Ask us, who would be good to do that, and ask us what we can do to help you through that process. So methyl mercury in fish. These are some of the fish that will contain mercury and may contain other heavy metals: king mackerel, tuna steaks, canned albacore tuna, Great Lakes fish, marlin, Mexican tilefish, shark, swordfish, grouper, walleye, and orange roughy. Now there are some fish that are safe, and the FDA recommends for fish servings in adult 1 to 2 6-ounce servings per week. These are some good ones: Alaskan salmon, pollock, Chilean sea bass, Pacific halibut, cod, tilapia, but that's honestly, it's not on my list anymore because it's all grass-fed it's all farm-raised, and I don't like farm-raised fish. I would not eat farm-raised fish myself because they put chemical feed and coloring and stuff like that in there. There are some really good places where you can buy seafood online where it's wild caught, and if you buy it in the store, it should say wild caught on the label. Skipjack light tuna canned is good, or there's another one, I'm sorry, my picture is blocking it, but it's called Safe Catch tuna, and it's checked to see if it has mercury or not, and trout is good. So those are some examples. I'm sure there's more, but those are the ones that I know about. Heavy metals compromise immunity. It lowers the numbers and activities of macrophages and natural killer cells. Those are the specialized white blood cells that take care of the foreign invaders. Lower resistance to bacterial, protozoa, and fungal overgrowth in the body is a problem. And lower antiviral and tumoricidal, that's anti-cancer activity. Decreased immunity with heavy metals. All of these metals, mercury, lead, arsenic, nickel, cadmium, and tin, lower the cell numbers and phagocytic activity. I put a little Pac-Man there. It's probably something that a lot of you aren't familiar with if you're younger than I am. I'm 60, but that was a popular game, and it does the same thing as phagocytes do. It goes along and it eats up the foreign invaders. But yeah, those are decreased activity if you have heavy metals in your body. And it also alters your gastrointestinal immune function, and it alters your nutritional status because it damages the lining of the gut, and therefore all the different parts of the immune system don't function as well as they should. The prevalence of GI problems, gastrointestinal problems, are one of the most common reasons people seek medical advice from our clinic and other places. The cornerstones of good health are proper digestion of food, assimilation of nutrients, exclusion of pathogens, and timely elimination of waste. So university-level research shows that heavy metal toxins damage the lining of the gut, leading to the types of gastrointestinal health problems that are mentioned above. And this is a personal communication I had with Boyd Haley, PhD, who's a heavy metal toxin expert, and especially an expert in mercury. So the benefits of detox, it's pretty obvious by now that you're going to be healthier. It's going to normalize the body's innate ability to detoxify. It's going to preserve body tissues and functions and maintain quality of life as we age. And it's going to prevent and or improve disease states, including but not limited to cardiovascular, neurological, and immune diseases, and kidney was in there as well. Limit the extent of daily toxin exposure from contaminated air, food, and water, and improve the immune system function and decrease risk for cancer and degenerative diseases. So that is why we should detoxify. It's important. And there are just a few examples of where we get toxins. And since it's not always possible to eat organic, pure, clean, unprocessed, all of that, and breathe totally clean air, we need to practice detoxification on a regular basis. And we should use some specific detox treatments that are shown to work by a trained medical professional. That's one of the things that we do at our office. We have some great programs, and there's lots of different choices for different people. And how do you get tested? Well, when you get exposed to heavy metals, there's a net retention, and then it does and can lead to toxicity. Exposure, we use a hair analysis for that. Now, this does not give an accurate assessment of whole body heavy metal burden, heavy metal retention. So what we have to do for net retention or whole body burden is we have to do a provoked urinary toxic metals test. And what we mean by provoked is we give you a chelating agent that's a heavy metal toxin binder, so it pulls out those heavy metals. So an example here, here's a urine toxic metals test, which was not, there was no provocative agent, there was no heavy metal chelator given. And then here is the same person after they got DMPS. And this was a person who was suffering from severe extremity numbness and tingling and brain fog and memory problems, and the analysis was made of a Franzia wine in the box, and it had lead and antimony 3 to 11 times greater than the limits for drinking water. And this chart shows what was found in that person's body. The net retention of lead and mercury was, well, mercury was off the chart. It was 230, normal is less than 4. And the lead was 25 and normal is less than 5. So she also had some antimony in there for sure, and the rest of the heavy metals look pretty good. Okay, another little quick subject I want to go over with you is fungal methylation of mercury. Basically, they did some studies where they took Candida and Saccharomyces, 2 different fungi, and or yeasts, I should say. They were incubated with mercury and transformed the mercury into methylmercury. It's a much more toxic form of mercury. The more mercury that was added, the more the Candida grew. So mercury is a survival mechanism for yeast. But in the process, this increased the toxicity of the mercury. So this is a double-edged, really bad sword that is really bad for you. If you have mercury, you're going to overgrow Candida. And if you have Candida, then the mercury is going to become more toxic. The Candida is actually trying to help you, get less of the effect of the toxic heavy metals, but in the end, it does turn the mercury into methylmercury, which is even worse. So if you have Candida overgrowth and you're doing a Candida antibody test, and you can't get rid of it, you should look into a urine toxic metals test to see if you have mercury, or if you do have those silver fillings in your mouth, you should get them out for sure, and then get tested for urinary metals at our office. Urinary metals testing, the doctor or healthcare provider will decide which chelator to use, which binder. Chelator is more than a binder, actually. I'll explain that in a second. And assess the kidney and liver function, assess the complete blood count, make sure all the blood levels are okay, and then do a little nutritional workup, maybe a hair analysis, maybe a blood analysis for minerals. Sometimes we might look at food allergies, we might assess gastrointestinal health and function before. We want to make sure a person is, having regular bowel movements every day, if not twice a day, and then optimize their nutritional status before chelating. And then we do this with diet supplements and maybe do a mini detox before. And what is chelation therapy? I've used that word several times, but chelation is derived from the Greek word meaning claw. And if you think of it like this, that chelator, it has a salt in the middle of it, and when it sees a heavy metal, it'll go dump the salt and it'll grab the metal, and then it will not let go of it until you pee or poop it out. So that's what chelation is. That's different from binding, where binding might go along and bind something and it'll pluck it out, and it might drop it off somewhere else in your body, or it might take it to the kidneys or the liver and the stool and dump it. But a binder is not chelating it and binding it until it goes out of the body. So it's chelation is stronger. That doesn't always mean that's the only thing to do. Some people, can't do it for some reason, or, we have to have different methods. So we do use binders as well, but chelation is different, and that's what it means. Chemically, this means the molecule surrounds and takes with it the thing it binds, heavy metals. EDTA is the most common chelating agent, and it's a synthetic amino acid that removes heavy metal toxins such as lead, aluminum, cadmium, and arsenic, and other metals as well. We also, right now we can't get DMPS, but we use DMSA in an oral form. That's often mostly used for mercury, but it also can pull out other heavy metals and lead depending on how much is there. And often we use these two chelators together. Some of it, as the bag shows you there, is given intravenously, and like I said, some of it is also given orally. But what does chelation do? It's a strong antioxidant. It gets rid of those nasty free radicals. It's a very light anticoagulant. It does not affect blood thinners, and it does not affect the tests. It just makes your red blood cells less sticky. It removes calcium from arterial plaques and helps the deposits of calcium move out of tissues into the right tissues. Stabilizes the cell membrane and reduces lipid peroxidation, like we talked about earlier. Increases magnesium in the cell and reduces muscle spasms, reduces inflammation at the cellular level, and by these mechanisms, immunity is improved and circulation is improved throughout the body and the small and large blood vessels. And I just wanted to tell you quick about the TACT study. This was the trial to assess chelation therapy, TACT. It was a randomized, double-blinded, placebo-controlled study, and it was huge. There was almost 2,000 people involved in it. It was overseen by cardiologist Dr. Antonio Gervasio Lamas, and he basically had a lot of dealings with the NIH and had done other research before, so he had the connections, and he got $30 million for this study. It was actually 1,708 patients, a total of 55,222 infusions of chelation, and these were given at 134 locations in the U.S. and Canada. And the study enrolled patients with a history of heart attack. The patients were at least 50 years old, and they had good kidney function, and the participants were asked to do 40 IV chelations. So the main TACT results were patients who received chelation had an 18% fewer cardiovascular events, including death, heart attack, stroke, and hospitalizations for chest pain or angina, compared to the placebo group. The diabetics fared even better with a 39% reduction. And I've talked to Dr. Lamas myself, and I've seen him lecture 3 or 4 times now on this, and he is still doing research on this. He's working on TACT2, and he's trying to get the FDA to, allow this to be done on a regular basis at, every medical clinic. He thinks every diabetic should be doing it. It works better than statin drugs. It's got incredible statistics. He said if it were a new drug, and it's not, the patent went out on chelation, EDTA chelation, 70 years ago. But if it were a new drug, it would be a multi-trillion-dollar drug because it works so well. That's how good the statistics are. Other TACT findings were that there was a reduction in the need for future cardiovascular surgeries. A surprising observation was those who benefited the most were the diabetics and those who'd had a history of a more severe heart attack. So the sicker the patients were, the more benefit they got. And Dr. Lamas states that the study proved that chelation is a viable treatment and will change the way diabetes is treated. In addition, it was proven that chelation therapy does not damage the kidneys. That's what people are worried about all the time, and it does not. Dr. Terry Chappell also noted when he reviewed it that EDTA chelation is safe. It's a safe treatment, and there were only 2 unexpected deaths, and one in each of the 2 groups that was getting chelation. And the chelation therapy showed an unexpected treatment benefit for post-heart attack patients who were already on evidence-based traditional medical therapy with drugs and lifestyle changes. So this was on top of everything else that they were already doing. They were already maximally treated by conventional medicine. So there's lots of studies on disodium EDTA. I'm almost coming up on an hour here, so I don't want to belabor this, but I'll just read the findings on these real quick. This study in 2004, 75% fewer chelation patients had bypass surgery compared to those who did not receive chelation. 3 studies on peripheral vascular disease here. In every case, the chelation patients improved 100% more than controls, 78% more than controls. And in the last study, it was a study how long people could walk without pain from peripheral vascular disease, and their distance without any pain with walking, it was 400% greater than the controls who did not receive chelation. And again, this, I mean, you can take a screenshot of this and read it on your own, but every study, these were the studies that basically Dr. Lamas looked at when a patient asked him, hey, you know, does chelation work? And he told the patient, no, it's not proven. I don't, you know, it's not a treatment that's known to work. And then he asked himself, wow, I wonder, I should look this up. You know, he was a researcher, he was curious, and so he looked it up and he found studies like this and many, many more. And he's like, wow, all of these are showing such good results, but there's such small amounts of people. I need to do a big study, you know, a double-blind, placebo-controlled study. And that's what he did. He made it happen. He was true to his heart and true to his word, and he got the money from the NIH. These studies are super expensive, especially on something that no longer has a patent. This is just incredibly unusual, and he is now a champion for us doctors that do chelation therapy and believe in it and have believed in it for so many decades. And now we have the actual proof as of 2012 that it does work, and it's a wonderful therapy for us to make available to our patients. So a lot of information, but what can you do now? What you can do now is make sure you take your basics: multivitamin, multimineral, a good calcium magnesium, one that's actually used by your body, not one that throws calcium in your arteries. You've all probably heard about that. And omega-3s. And maybe probiotics are a good idea too. Eat organic food or as clean as you can, and minimize the processed food. Eat real food. You know, shop on the outside of the store. Eat things that you can open up your refrigerator and eat. And eat a lot of plants. I'm not saying a total plant-based diet, but a lot of plants do wonderful things for your body and can help reverse heart disease. Work with a holistic practitioner. Refine your program. Detox regularly. Clean up the gut. Chelate out heavy metals. Do a mini detox program. I'll show you one here in a second. Do not heat food in a microwave in plastic. Use glass, polycarbonate, or stainless steel water containers. Clean cosmetics like our KPS Luxe organic products. We don't have makeup, but we have, you know, moisturizer and cleansers and things like that. Exercise regularly. This supports natural detox. Sweat a lot. If you have a sauna, I'm sorry I didn't put it on there, but saunas are fantastic for detox. Proper sleep. Drink purified water and eliminate regularly. You've got to keep those bowels moving. Our mini detox programs, we've got them 10, 21, or 28 days, whichever one suits you best. You know, Amanda at our office in the supplement department, she's our supplement director. She, or any of our girls that answer the phone, but Amanda's the go-to gal, can tell you which one to buy and the different ways to go about it. They're not hard. I do one every spring and fall with the Ultra Clear Renew because that's the product I like the taste of, and it gets out more than just, you know, chemicals. It gets out some heavy metals as well. Daily detox supplements, your antioxidants and your high quality multivitamin, your purified fish oils. They help your cell function stay active. NAC, that's N-acetylcysteine. I take this every single day, and I am a testament to N-acetylcysteine. I had low glutathione levels that were going down over the last 10 or so years. In the last 2 years, I have raised them up into the normal range, and I'm very proud of that. I also love NAC because it's great for my allergies. I can often only use that instead of having to take medication, which I hate taking for my allergies, but sometimes I do. Alpha lipoic is another one that's great, especially if you're diabetic, because it helps blood sugar, it helps cravings. It also turns into glutathione. You can take them both together. They work synergistically. Zinc, taking more zinc can enhance the natural detoxifier metallothionein. Zinc maximum intake for children under 8 years old is 4 to 12 milligrams per day. For children greater than 8 years old, 20 to 40 milligrams per day, and then adults usually 20 to 50, but we usually measure levels in adults. And I've seen people sometimes need, up to 80 to 100 milligrams. It's unusual, but then we have to keep checking it because we don't want it to build up. You can get too much. Metalloclear is a supplement from Metagenics that we sometimes use that has some good research for lead detoxification. Chlorophyll and good chlorophyll products, you have to make sure you have a clean one. Porphyrozyme from Biotics is one of my favorites. You can take it if you eat some dirty seafood or you think you might have eaten some food with heavy metals in it, and we'll take some of those out. And clean cosmetics, definitely that's part of your daily detox. And get tested for heavy metal toxins. These are the things that detox aids you would need doctor approval for at our clinic. And we just surpassed an hour, so I'm going to wrap up here. But you can see we have several IVs that really help. And then we also have Nanobac TX, an oral chelator, which I've used on a number of patients. Oral DMSA as well, that requires a prescription. And coming soon, I am looking into CellCore. I've had some patients use CellCore oral detox programs for mycotoxin illness or mold illness. But as I'm learning more in their learning center, it's not just for that. It's for heavy metals. It's for general cellular health and function. And I'm looking forward to starting some of those programs. I'm going to do their 4-month foundational detox next year, and I'll tell you how that goes. But there are many special tests we can do as well to check for toxicity and see where we need to help you. So, take-home message, we're all exposed to toxins. Toxins including heavy metals, environmental toxins, chemical toxins, daily. Toxic buildup in the body can have very serious health effects. Assessment and diagnosis is made with appropriate testing and monitoring. Keep your basics in for improved detoxification. Do those mini detoxes once or twice a year. Chemicals and heavy metals can be safely removed, and detox mechanisms can be restored to full functioning and improved health. That's why we do what we do. And if you have any questions, please let us know. You can always go to our website, nhicwestmi.com. We have tons of information on the site, lots of things you can read and learn from. And, if you want to see one of our practitioners, we're always taking on new patients. You can call the office, 616-301-0808. That's 616-301-0808. If you have to, you can leave a message and we'll gladly get back to you, usually within, a few hours, if not less than a day. But yeah, check out our website. We have so much information there, and we talk about a lot of the things I've talked about tonight. And I thank you so much for taking the time, taking an hour out of your life to listen to me talk about these interesting issues, and I hope you learned something. And thank you for attending and listening. If you do want to comment down below on the Facebook Live, somebody will definitely also answer you there within 1 to 2 business days. But remember, it's always time to detox, and we're here to help you at the Natural Health Improvement Center. Take care and good night.